U. It's a game changer, a game changer. U equals U. It's a game changer, a game changer. Sing U equals U. U equals U. Shout U equals U. U equals U. Sing U equals U. U equals U. Shout U equals U.
Hello everyone. Hello. Hello.
Hi, William.
Thank you for coming all to this U equals U African Forum. My name is William Matovu from Uganda, and I work with the Love organization. We want to thank you for filling out the survey. It has helped inform the agenda. It has helped inform the agenda and provide ideas for the future forums. This forum builds from the U equals U conference and the march that took place in Uganda with the Love organization 2019 and the Center for the Youth of Hope U equals U conference, which took place online in 2020. Thank you for filling out the pre-surveys. We learned that your goals for the forum are to learn about the diversity of strategies for promoting U equals U message, how other countries have implemented the U equals U message, innovative ways to reach key populations and other forms of other groups about U equals U message, collaborating with the U equals U partners in the countries where you work, and global best practices for the U equals U communications. We will cover all of these. What is the objective of the forum of U equals U? The forum, the Africa U equals U forum, sorry. Now that the message has been confirmed by science, it is our role as people who care about people living with HIV and ending the epidemic to collaborate to communicate this message. And this forum is about how people are communicating the U equals U message. It is an opportunity to share what we are learning with others and to identify the programs and the people on the continent who are doing the work. That means U equals U work. So we can work together. We also want to build this movement in Africa and to mobilize to build this movement in Africa and mobilize other stakeholders in Africa to join us. The more we come together, or the more voices we have, the more effective it will be. So today's agenda format has changed a bit. We have 2 sessions of presentations. In between the presentations, we'll break out in 2 rooms to reflect on the lessons learned and then report back to the group. Please post questions that you might have in the chat box, and we will answer at the end of the second group of presentations. For those who have sent in slides, feel free to let us know if you'd like to share them during the breakout rooms or discussions. Only brief, please, and only if they are relevant. The forum is being recorded. That is a reminder. If you're uncomfortable, you might shut off your camera, but we would love to see all of you. And at the end, we will put together all what we have learned and we share it with participants as the community. As what? The community. So, as you can see on your screen, it is a U equals U global picture, how U equals has been transforming lives of people living with HIV globally. So this forum is part of the U equals U global strategy to stimulate and support regional and country U equals U movements. the U equals U movement is now the U equals U movement is growing so big, and we have over 1,040 organizations from 120 countries that are signed on this campaign. There are many opportunities to learn from each other and collaborate from every continent. We must share with each other to avoid reinventing the wheel and ensure the message reaches the people it was meant to benefit. So this forum is the first step to bring people together. This is just the beginning. So without wasting time, I will introduce our first speaker. Name's Mandisa. She's a co-founder of HIV Survivors and Partners Network, a clinician with more than 15 years of experience in clinical management of HIV, a community system, strengthening consulting, and an ANAVAC 2020 fellow. She has been open living with HIV for 18 years and in a discordant marriage. She's leading a women living with HIV, and these are championing U equals U in South Africa. So Mandy, the floor is yours.
Thank you so much, William, for that introduction, and good afternoon, good morning, good evening, everyone. And yeah, this is a South African-based campaign led by HIV Survivors and Partners Network. Yes, Lamont. HIV Survivors is based in South Africa as an organization, but to be specifically, we're based in Gauteng. It was established in 2018 by female nurses that are openly living with HIV. As a founder, speaking to you, I have 15 years experience, as William is saying, in clinical and CSS. We have more than 20 affiliating organizations in the country and more than 400 individual affiliates in the country. I will get into the presentation. Who is intended to listen or to hear the message about U equals U that is being rolled out by HIV Survivors and Partners Network, and what is the language and the visuals that we are using in our campaigns? You know, as a small organization, we are not big, but we really would want to reach as many people as possible. So in order to have an extension arm or to have a reach as we're expecting, what we do, we'll do consulting with workshops. What we do, we're putting together women living with HIV groups, and we're empowering them, we're capacitating them with the U equals U message. We're also doing activation workshops with AIDS Council Secretariat. We're also doing workshops with civil society organizations. And recently we had about 400 clinicians in South Africa whom we empowered about U equals U. So those groups are the people that are assisting us to spread the message in the country across all provinces. So the pictures that you are seeing there, those are the activation workshops that we're having. So what we do as people living with HIV now, because we have about 110 U equals U pioneers in the country that HSPN has trained to be pioneers and lead this campaign. These are women living with HIV in particular. We also have discordant partners in the groups. So what we do, we go into in the locations, in communities, we go in the street, we distributing flyers. These are the campaigns that we had in different locations. Those women in particular, they are openly living with HIV, and they're volunteered and they are dedicated in spreading the U equals U message in the country. So we want to make sure the message is able to cut across, and each and every person, whether literate or illiterate, is able to read and understand the U equals U message. So our IEC material is written in English, but we're trying our best because in the country we've got 11 languages. So we've managed to actually convert one into Xhosa, one of the South African language, so that Xhosa speaking people are able to read and understand the message and the gist of the U equals U message. So we are about to develop more depending on availability of resources, but then this is how we're making sure that we're reaching everyone. And we've got posters. Those posters, they are personal messages from people living with HIV. We've got flyers, we've got fact sheets, and we are documenting, recording video clips of people living with HIV in the picture, for instance, in the poster, rather the couple there, the woman that is in the picture, that is me talking. We're using personal messages for people who benefited in the U = U message. Next. This is one of the material that we're using. And at the other side of this flyer, for instance, we've got messages of women living with HIV, personal messages. We've got messages of other couples that have benefited to U = U. Currently, only these flyers are written in English, but we'll have more written in the vernacular languages. So what was effective in our messaging? One, we make sure that we use real pictures, because we've seen people, they connect more when they see personal or real messages, and we're using local languages so that people can relate, and real life stories. We don't like to use theory, and people, they engage more and they buy into personal and real life stories. So that has been effective. And also we're going to homes, we're doing door-to-door, distributing flyers and answering questions to people that are not certain or they don't know anything about U = U. The colorful t-shirts that you've seen in the pictures and the placards and banners, that is what is actually drawing people to come closer and wanting to know more about U = U from the groups. And the timing that we're using, we're mostly doing these campaigns in weekends, because we know that's when people are at home relaxing, and we'll be able to reach them in their homes. What are the challenges? To be honest, in South Africa, the buy-in is very high when it comes to communities. The reception is very, very, very positive. The issue is the buy-in from the government. So far, there is no national campaign. Government is like very slowly in terms of buying into the campaign, and the lack of resources rather is also an issue, because we really want to reach as many people as possible. And how do we determine success? I think the slides will actually tell more about it. The next one, Lama. I'm not going to go through these messages, but then in our radio, slots, when we talk about U = U, we get so many questions, so many comments, people commending us. Social media, we've got so many inboxes. In the street, people coming to us and approaching us, looking at our faces and comparing our faces with what is in the pictures. And so we see people are really, really learning a lot about this. But then most importantly is the testimonies from people that are learning from our groups and from our campaigns. When they actually say they can't wait to reach an undetectable level, people, when they get to a year of being on treatment, when they're praising, coming to our groups and sharing their viral load, and then, this is inspiring when we actually see people praising the benefit of getting the information about U = U. Like, for instance, this particular lady, she was just 2 months on treatment, but she said she couldn't wait to actually get into 6 months so that he can also be undetectable. So that's the benefit. And this is how definitely you are measuring the success, because it's not only about sharing the information and the communication, but what is the impact? And again, the knowledge that we're actually seeing increasing in the people, that's also how we measure the success of our campaign. Next, Lamar. So I'll just briefly talk about this, less than a minute. This is one of the success. For instance, we created a group in 2020 February. This group is led by the nurses that I talked about. We currently have more than 400 members that are part of the visual safe space. The only message that we're sharing in the group is the importance of adherence and the importance of viral suppression. When we started this visual safe space, this is a support group. When we started this, 67%, it was 63% viral suppression across all members, was at 63%, but currently 97% success of viral suppression, meaning people, as soon as they hear the benefits of art and the benefits of viral suppression, that they won't transmit HIV, they will live longer and stay healthy. People, they are bound to listen and do exactly what their peers, that is us, doing. Now we're sitting at 97% because of the benefit of the U = U message. Next, Lamar. The lessons learned. What we've learned as the advocates in South Africa, there's nothing as powerful as a peer-led campaign, because we talk from personal experience, and we share exactly what has helped us as peers. And sharing this message, it promotes status disclosure and reduced stigma. And when we sharing this message, people, they are engaging more and they're relating more, because these are real life stories. And what is also critical and very important as advocates in the region, we're saying if we can get resources, we can ensure the countries that we're living in, they are achieving the second and the third 90. I think we all know that currently we are lacking as the region on the second and the third 90, but based on the successes that I shared, that with the U equals U message, we can do this and we can end the epidemic by 2030. I think this is the last slide, Lamar. Thank you so much, everyone, for listening, and thank you, Lamar. I'm sure we started noting questions for, by the end of the session, we'll have Q&A.
Okay, thank you so much, Mandy, for that wonderful presentation. And I think without wasting time, we have to continue to another speaker.
Hi, everybody. This is Nina Hazen from PSI Washington. William, can you confirm that you can hear me?
Yes, I can hear you.
Great. Thanks a lot. Lamar and Bruce asked us to talk a little bit about the work that we're doing across several different countries. We're taking a commercial marketing approach to spreading the word about U equals U. Next slide, please, Lamar. So lots of you know Population Services International. We just celebrated our 50th birthday, and we've been branding health products for over 50 years, from water treatment to oral contraception to condoms. You probably are familiar, lots of you, with different PSI condom brands, and to complicated medical procedures like medical male circumcision. And we know that strong brands that are successful in getting people to pick up products and services, they speak to consumer preferences, to what people actually want and feel, not always to public health messages. So we're trying to approach U equals U from that perspective, from what do ordinary people understand and want from around HIV and HIV treatment, not necessarily what the public health community, what we want other ordinary people to feel and want. Next slide. So we, through various different projects, have been asking, and I'm calling people living with HIV and the community around them consumers, to sort of reframe our thinking from thinking about people as quote unquote beneficiaries, which PSI thinks diminishes people's dignity, to thinking about people as consumers with agency in their own lives, in their own communities, to make choices. So when we talk to consumers about HIV and ART across now about 4 or 5 different countries, here are some themes that have been emerging as consistent. People tell us over and over again, especially as we're diagnosing more and more young people living with HIV who don't necessarily have symptoms, that their fear of the social death from the stigma of HIV is as great as, or at least equal to, their fear of physical death. And that's really influencing their choices around ART. That being diagnosed with HIV makes people feel different. It makes them feel different than they were before, and it makes them feel different from the people around them in their community. And that feeling is really painful and a source of a lot of struggle. People know that ART keeps them alive, but by and large, most people don't know that ART prevents onward transmission of HIV. And that's a huge challenge. And when people do know, when we tell people through our programs, or when we talk to people who are being informed about U equals U at the clinic, what many of them say to us is, it's not enough to tell me that I can't transmit HIV once I'm virally suppressed. You need to tell my community. Other people around me need to know this too, or the real benefit of U equals U won't mean anything. It won't happen for me unless everybody understands this. So that's our challenge. Next slide. So we've done some work on this in a bunch of different countries, and I'm going to show you some examples. So this first example is work that PSI has done in Eswatini with funding from the Centers for Disease Control. And here we did a bunch of desk research. We weren't able to actually go out and talk to as many people one-on-one, but we came up with a campaign around the notion of standing. We stand, or I stand. On the left, you can see one of the audiences that we really wanted to reach was adolescent girls and young women. And for them, the most important thing about for them was education and getting to lead a full life. And so we really positioned treatment as a way to enable girls and young women to lead that full life. The middle couple, the translation of that is, I'm living with HIV, she never will be, we stand. And so that positioning is really aimed at couples, at serodifferent couples, and creating this notion of people, of couples being together. And on the right, you can see communities standing together. And this is really, again, aimed at this idea of making sure that everybody knows that HIV treatment prevents onward transmission. Next slide. And can you hit it one more time, Lamar? This is a campaign that we're running in Mozambique. This campaign was commissioned by USAID with a specific focus from the whole PEPFAR treatment community around encouraging both a reduction in stigma around HIV and encouraging more men living with HIV to start and stay on treatment. The theme of this campaign is Somos Iguais, we are the same. And this really emerged directly from insights that we garnered when we talked to lots of men living with HIV, where they said, we are the same as everyone else, but nobody recognizes that. When people find out we have HIV, they think we're different. And the most important thing for us is for people to know that we're the same. And we're the same because we're virally suppressed and we can't pass on the virus. So we can have a life just like any other person. So we built a whole campaign around this idea of we are the same and together we win. And there's a beautiful ad that goes with this campaign. I'll try to figure out how to make it available to everyone. Right now, it's still only in Portuguese and we're trying to get it subtitled in English so that more people can understand it. Next slide. In South Africa, and my colleague Sean Malone is on the line as well, we've been running work that's not at the mass communication level, but that's a level down at the community that's aimed again at assisting men to start and stay on HIV treatment. And a big component of that is Coach Mpilo, who is a man living with HIV, who's out about his HIV status and about the fact that he's on treatment, and who supports men who've been diagnosed to start and stay on treatment. And a huge part of what Coach does is communicate about viral suppression and U equals U. And our partner, Matchboxology, who helped develop the Coach brand, developed these bead bottles that you can see on the right that are a tool for helping people understand viral suppression in very simple terms. One of the things that we've heard over and over again is that terms like undetectable and untransmissible and viral suppression, these are terms that are hard for everyday people to relate to. So we're really working on ways to make these concepts very easy for people to understand and communicate. So the bottle in the middle might represent a person who's just been diagnosed with HIV, where the black beads represent healthy cells and the red beads represent cells infected with HIV. And we just explained, if you don't take treatment, HIV will take over your body, like that bottle on the right, and you'll get sick and you'll die. But if you do take treatment, the treatment will kill almost all the HIV in your body to where you just have that one tiny red bead, but most of your body is healthy black beads, and you won't get sick and you won't be able to transmit HIV. And this visual representation makes this concept very approachable and very understandable. And we're looking at helping more and more clinics in South Africa and others have access to these bead bottles or to a video that feature these bead bottles to help explain this concept. Next slide. We now have funding from the Bill and Melinda Gates Foundation, Johnson & Johnson, and support from PEPFAR to try to elevate this work to sort of what we're thinking of as the next generation. And this project is called Flip the Script. It's based on this idea that right now people associate HIV treatment with HIV itself. And so the treatment holds the stigma. And what we want to do is flip that script, flip that narrative, so that now treatment is the solution instead of the problem. And I've chosen these two images to help understand, or to help picture where we've been and where we want to go. So on the left is a very like traditional public health kind of messaging campaign, coughs and sneezes, spread diseases. And that's the kind of language that I think often public health communication has used. It's very focused on what the public health community cares about, and not so focused on what individuals and communities care about. On the right is an example of an ad campaign for Safaricom that was developed and run by our partner in Flip the Script, Fieldstone Helms, which is an advertising agency based out of Nairobi, Kenya. And what they did in this particular campaign was figure out emotionally where young people are in Kenya and what is going to speak to them around, in this case, their telephone company. But we're going to work with them to help generate a new concept that will have the same emotional power that U has had in Western countries, but that's more tailored to the African setting. And of course, because we're being funded to do this by the Gates Foundation, everything that comes out of this project will be publicly available and open source for everyone to use. So we're really trying to develop a brand for treatment that's not specific to a particular drug, but to the concept itself. And that will be available for use all over the continent. And we're piloting this in Malawi and Zimbabwe, and we should start having ad materials that running on TV, radio, billboards, social media, etc., sometime around late August of this year. Next slide. I think that's it. Lamar, thanks for this opportunity to present to you. We're so glad to be part of this community and this gathering. And if there's questions, I'm happy to take them when the time is right. Thanks.
Thank you so much, Nina. Thank you so much for this presentation. Our next presenter is Kennedy Mupeli, is an advocacy officer at Center for Youth of Hope in Botswana. As an advocate for people living with HIV and treatment access, Kennedy has also engaged the movement to end HIV as an AVAC fellow, alumni, and with IAS Advocacy for Cure Academy. So, Mr. Kennedy, the floor is yours.
Thank you so much, William, for this opportunity. I would also want to take this opportunity to thank the previous speakers. That was so wonderful. Yes, my name is Kennedy Mupeli. I'm from Botswana. I've been living with HIV for over 20 years now, knowingly that is. So I'm a long-term survivor, in other words. Thank you so much. And can we move to the next slide? So I work for Center for Youth of Hope. The organization was registered in 2002 to support and strengthen the ability of young people living with HIV. And we do this through education and advocacy. We also implement community-based organizations, community-based activities aimed at helping young people to lead a complete health life and reduce the risk of transmission of HIV. So CEYOHO also brings together young people to play a leading role and participation in shaping policies that recognize and appreciate their role in national HIV care and support programs through training and mentorship. CEYOHO also promotes client retention and care with aim of maintaining viral suppression. Next slide, please. So this is our center. It's just outside outskirts of the capital city, Gaborone. This is where we operate, and that's where I'm actually transmitting from. So we know that HIV treatment has demonstrated by far the most substantial effect on HIV incidence when viral load is suppressed. So we just don't get that information much from healthcare workers. When we visit, we go for medical checkups, routine medical checkups in our various, health facilities. We are only taught that treatment will actually, you will live longer if you take your treatment, but the other benefits are not explained to us as people living with HIV. Next slide, please. So we had some kind of a problem when we started the UCOSU campaign in 2019. We didn't know the approach to take, and based on our previous experiences, we realized that the gold standard of communication approach should also apply when delivering UCOSU message to the community. So we actually trained our peer educators in how to analyze the audience, how to set goals and objectives, and crafting catchy messages, and also how to develop a communication plan, and which is tailored to specific audiences. So we also, in the process actually of developing a monitoring and evaluation tool, and we want actually to conduct this, supplement this with a survey that we want actually to measure the knowledge, attitude, and practices among healthcare workers and people living with HIV regarding UCOSU. Next slide, please. So we know that people living with HIV organization can meaningfully be involved in many levels of UCOSU campaign. What we just need to do now, and what we are doing ourselves, is we are actually building the capacity to understand the science. We have realized that for us to actually make a meaningful impact on the community, we need to empower people that are going to empower others with science literacy, because UCOSU is a radical message which requires, the conveyor of the message to be actually equipped with the information, because we do not want messages that sit on the fence. You equals you and nothing else. We don't want messages that say in case or otherwise just use a condom. And this, as people living with HIV, we have the right to enjoy sex. Sorry to say this, and this is the reason why we want this science to reach out to everyone. We want to empower everyone, empower the empowerer also to actually deliver this message across. What we all need are just resources for us to be able to undertake this task. Next slide, please. So increasing awareness that having undetected viral load means that people living with HIV will not transmit the virus. It can have a dramatic impact on public and personal views. We know that, and HIV stigma is the biggest barrier, to ending HIV, because we are known to be infectious. So most important is to break down stigma where possible by providing access to information, to community support, advocacy, or which build hope. We know that because we have the potential to address all kinds of stigma. And when we talk of, if we talk of the barrier, the biggest barrier to ending HIV, we mean stigma poses a barrier to access to treat, not only to treatment, it also poses a barrier to access to testing itself. People don't want to test because of the don'ts that are, heaped on people living with HIV. So with UCOSU message, that burden is actually lifted off our shoulders. So next slide, please. So what message do we deliver to our peer educators? Because we want them to be so confident when they are talking about or sharing U U U messages. Actually, what we have done is we want them to understand, we made them understand the studies that were conducted and that support the U U science from the HPTA in 05. Two, I call it the mother of all clinical trials myself, and I love of all the clinical trials. This is my favorite. Then we also talk about the opposite attract study, partners 1 and 2 studies. We also share among our peer educators and community members the consensus statement, because people would also want to know who else has endorsed the message. They want to know prominent organizations, prominent individuals that have actually endorsed this statement. So we share that information with our peer educators, and they are fully equipped with that. We also train our peer educators in basic U U communication strategy, as I earlier on stated, how to analyze the audience, how to set goals and objectives. Because, when you talk of audiences, you cannot avoid talking about sex when you are going to talk about U U, because HIV is sexually transmitted. So when you go to the clergy or the churches or religious people, you need to be crafty on how you actually mention sex in a way that it will not offend the audience. So we also dwell much on setting of goals and objectives, so that when you are talking to someone, you are delivering the information or increasing somebody's knowledge. What do you want them to move into some kind of action? We don't just talk for the sake of talking. We talk to people because we share this message because we want people to move into some kind of action. Without that, then the whole communication process is meaningless. So we also want to do craft messages. You see the materials that the U material that we crafted, we've been displaying on T-shirts and wristbands and so forth and so on. So in most cases also, we do some quick pre and post surveys before and after every community engagement. So this pre and post survey measures the knowledge before we actually deliver the U message, and also we compare the message, the post survey to the pre-survey, and see if there've been some change of knowledge or attitude towards U message. I don't think this is the last one. Next slide, please. So why do we propagate U message? We know that the message has positive impact on self-reported mental health, sexual and overall health and well-being of people living with HIV and all those and our partners. As I'll keep on saying this, sex is a right. Everyone should enjoy it. I don't know whether it's like I'm the only one talking so much about sex. So I don't know whether it's only me who enjoys it more than others. The joke. So raise awareness that having an undetectable viral load means that people living with HIV cannot transmit HIV. We know that stigma impacts on uptake and utilization of AIDS programs. We know that, but we know that U actually can be used to actually counter this, stigma. U message has the potential to address all kinds of stigma as stated earlier. Next slide, please. So we have a national WhatsApp group that I actually formed because I'm leading the U campaign in Botswana. I formed this group in 2019 just to increase interaction around the subject matter and just to reach out. We have clinicians inside, we have people living with HIV in the group. So in November 2019, we also convened U U meeting where we invited the Ministry of Health and officials, and we had one official from PEPFAR Botswana. And on this note, I want to take the opportunity to thank the PEPFAR officials in Botswana. They've been so supportive, and I know they're appreciating what we are doing and what I'm doing and what I'm motivating other people living with HIV. Next slide, please. So we also organized the first Africa U U CEYOHO Forum webinar on 3rd October 2020. The objective of this actually was to provide advocates across Africa accurate U U messaging for use in their community work. U U message has to be clear, you know. I'll repeat what I said earlier on. It has to be very clear. It means when you are undetectable, we don't want people to start using, you reduce the chances. We are saying you cannot transmit HIV, and that's what science says. It's not me saying it, that's what science says. And to provide opportunity for attendees also to increase knowledge about the science and movement behind the U U. And that's why we invited the most vibrant U U global advocate, Bruce. He also presented in that meeting. We had Mandy, who is on this program also. He presented earlier on. And we had William, also from Uganda, who is on this meeting, also presented in this meeting. Next meeting, please. Sorry, next slide. So we are also using facilitated film screenings. We use the power of facilitated film screening for community engagements. One of the films that we did, short is 5 minutes, is actually on this. You can access it on YouTube. So we allow community to watch the film. It does not actually talk about you, because it talks about a situation where a couple, a wife discovered that the husband is on treatment, and the wife is so worried, and she decided to go for a test and test negative. Next slide, please. So these are the materials that we have done: shoulder bag, banner, wrist, water bottle, and wristband. Next slide. These are the t-shirts that we have done with U U messaging in behind. Next slide, please. This is a community workplace outreach on U U. Next slide, please. Yeah, this is a banner, and this is, yeah. Next slide, please. Yes, everyone who visits us at the center, we actually do a photo session with a U U banner. Next slide, please. I think thank you so much. That was the end of my presentation.
Thank you so much, Kenneth, for that presentation. And I want to remind you that whoever presenting, try to follow the time that we have put in place. Our next presenter is Dr. Simon Agarori. He is a medical epidemiologist and public health expert with vast experiences in HIV program development, implementation, evaluation, and monitoring, and program manager in low resource settings. Dr. Agarori joined CDC Zambia in 2018 and has focused on building capacity of provincial health offices to improve the quality of HIV services outside urban centers. He introduced the clinical mentorship program and use of innovative strategies like ECHO to build capacity of health workers to achieve 90-90 targets in each province, supported by CDC. He has led the development and rollout of U U strategy in Zambia. Mr. Dr. Simon, the floor is yours.
Well, thank you, William, and good afternoon, good morning, everyone. I hope you can hear me okay. Can you hear me?
Yes, we can hear you.
I just want to start off by acknowledging the fact that we are beneficiaries of many of you and the great work that you've done. In 2018, after the IIS conference, we came back after we saw presentations by Prevention Action Committee. We came back committed to wanting to implement U equal U in Zambia because we saw that there was a big need for it. To get that going, we benefited also from the work that John Blanford and CDC Vietnam did, and actually even some of the work that you did in Uganda. So what you see here, it's borrowed ideas from many of you, and then we try to come up with one national strategy for U equal U in Zambia. Next slide. This is just the outline, the strategy, the different levels of campaign that we conducted in Zambia, lessons learned, and conclusion. Next slide. So for our communication strategy, we focus mostly on the message. What is the message? What is it that we're trying to communicate? As many of you shared, having a clear and concise message was really important. And so we talked a lot about, okay, we need that for sure. How do we go about doing that? So understanding the local context was important. In Zambia, the technical working group at the national level is very influential. They have scientists, they have clinicians, they have people living with HIV who've been on treatment for a long time, and then other CSOs. So getting them to buy into the U equal U messaging was important. And then political will. So we had to look at, okay, what is it like? Is it something that we can do, and how do we frame it to fit into a local context? And then who are the influencers? So in Zambia, there are political leaders for sure, religious and traditional leaders. They hold a lot of sway among the average Zambians, and what they say matters. Musicians are really important, especially with the youth, and then marketeers. And I'll talk about the marketeers later. And then how best do we share the messages? What's the best communication medium? Because not everyone is going to watch TV, not everyone can read newspapers, not everyone can join conferences. So how do we communicate this to the larger swath of Zambian population? Next slide. So in terms of the messaging, we used the fact that most Zambians, they are familiar with HIV epidemic control, and they want Zambia to achieve HIV epidemic control. So we used this and said, okay, we know that to achieve HIV epidemic control, especially that 90, the third 90, you really have to go through U equal U. So we thought that this would be a good way to bring U equal U into what's already popular with average Zambians, with the politicians, with the healthcare providers. So that's what we decided to do right up front, that we're going to use epidemic control and tell everyone that for us to get to HIV epidemic control, we cannot bypass U equal U. You need to go through U equal U. Next slide. So this is one of our first engagement meetings. This is the National Technical Working Group. We get their buy-in, and we use science, basically explaining the science behind U equal U. And then we use the slides from the PAC and also from CDC Vietnam, and then to guide the discussion. And it was really very informative, because once we got the buy-in from this group, we knew that it would be a lot easier to get buy-in from other people. And they also are very influential. Without getting their buy-in, it would have been very difficult to move beyond Lusaka and try to do more with U equal U. Next slide. So the next thing is engaging with community leaders and key stakeholders. And this picture, what you see, this picture was taken in Western Province, and this is the royal establishment. They're very influential. So what they say, people listen to them. So we felt that it was really important to get them engaged and to explain U equal U to them. And in this hall, again, in your left, there are a lot of local journalists. These are people that have local radios, and people in those communities listen to them more than they listen to the national program. And then you have religious leaders, and you have many other people. And it was really very engaging. So distilling the message of U equal U down to a level that an average person can understand, a lay person who's not a healthcare worker can understand. And then there were a lot of questions and answering their questions so they can then become advocates for U equal U. Next slide. So this is in one of the other provinces. This is in Eastern Province, and I was engaging with them around U equal U messaging. These are the health leaders in the province, along with community leaders, and explaining the same messages. What is U equal U? What's the sign behind it? And what does that mean for our context? And getting them to understand it, and so they can advocate on behalf of U equal U. Next slide. So the political leadership was really important. When in our context in Zambia, if you want to find out who is the most influential person, who do people listen to the most, is the president. So we thought that having the president join the launch of U equal U will go a long way in helping us disseminate that message to the lower levels, because once they see that the president is involved and people feel that, okay, this is really important, we need to pay attention to it. So the picture to your left in the middle, that's the president. This is on the national launch of U equal U in 2019. And to his left, that is the former US ambassador to Zambia. And to his right, that is the WHO country representative. And the young person leading them here, that's the national ART coordinator, again, explaining the U equal U and the concept behind it. And again, the picture to your right, that's the president, that's the former US ambassador to Zambia, that's the Japanese ambassador to Zambia, and behind him, that's the Lusaka minister for Lusaka. So it was really important to bring all this political leadership to this launch. And we were only really interested in having some sound clips and a picture like this, but it exceeded our expectations because they were all interested in Zambia achieving HIV epidemic control. Next slide. And we didn't forget that the goal behind all of this is actually PLHIV first and foremost. We wanted them to understand the importance of U equal U in listening to their voices, listening to their concerns. That was a big part of why we did the U equal U campaign. So to your left, you see many people living with HIV who came out and supported the launch of the campaign. To your right, upper top, you see the ambassador and one of my journalists talking to a couple who are in sort of discordant relationship, where the wife is living with HIV and the husband is HIV negative, and then they have an HIV negative baby. And it was really important for them to speak out and for others to see that this is not just a theoretical thing, this is a reality. And as a result, many people living with HIV felt emboldened. So this is one of the Facebooks here, national Facebooks with people living with HIV posting about their status and talking boldly about the importance of U equal U and what that means for them. Next slide. And these are the provincial launches. So we did the national one, and then we went to the provinces. So you have breast bands, you have youth, we have different people coming out to support the launch of U equal U. This is in Eastern Province. Next slide. This is in Southern Province. And you can see here, we have the military brass band joining the launch of U equal U. And a lot of people came out. And it was really, it was interesting because people were asking questions, and then it was the local leaders who we have engaged that were answering some of those questions. And next slide, we have traditional leaders from across. So this is the traditional leader on behalf of all the traditional leaders in Eastern Province, talking about U equal U messages. You know, wearing a hat with U equal U. So it was really important because, again, members of that community, the Tata province, they listened to this leadership, and it was really important to have them engage. Next slide. This is in Southern Province, and also this is the traditional leaders in Southern Province. They were all engaged in the U equal U launch. Next slide. Youth getting an artist that people listen to was really important. So The young man in black shirt with U Equal U shirt, he is B-Flow. He's one of the foremost artists here in Zambia. He's listened to by most youth. So he is the one that did our theme song for U Equal U campaign. And I put a link in there, and I hope someone, maybe Lamar, can share the link. With U Equal U, you can win. It is a very popular song in Zambia, and people have continued to listen to it. Next slide. Now, it did not stop at that level, because we knew that getting healthcare workers to understand U Equal U is also important. So we had to design trainings around, it was customer care, patients being at the center of what we do, but also getting them to understand the U Equal U, because if healthcare workers understand, then they can really support patients to deal with the self-stigma and all the different things that PLHIV have been dealing with. Because, you know, as you all know, as healthcare workers, we have contributed to a lot of that, because we were telling people early on in the HIV epidemic, you know, you cannot have sex, you have to remain abstinence, et cetera, et cetera, et cetera. So it was really important to educate healthcare workers so they can also do their part in reaching patients when they meet with them. Next slide. And then this one was U Equal U messages, brochures, posters for patients, things that they can look at in very simple language, very direct. That if you have undetectable viral load, you're not going to transmit HIV to your partner. So we made sure that that was communicated clearly without any ambiguity. And that's still ongoing. So we have this at many of our ART clinics, and we distribute this on a regular basis. Next slide. So what are some of the challenges? So we've done all of this, but how do we maintain momentum? This is something that we've struggled with. We thought about this as one strategy going from the top to the bottom, but how do we maintain it? And designing messages for different populations. In Zambia, and like in any other country, so we have different people living with HIV, you have adolescents, you have heterosexuals, same-sex couples. How do you design messages that can apply to their context? To the context of different populations, and then navigating local context. You know, if the messages is not, if it's seen like they're pro certain groups, there may be pushback. So how do we manage that appropriately, where you still provide the right messages to different groups without worrying about the local context? And then how do you measure impact? That's something that we have continued to struggle with. Initially, we thought about viral load suppression and viral load coverage, but we know that there's many ways, and we're looking forward to learning from you all. Next slide. That might be the last slide. So in conclusion, U Equal U campaign can be rolled out successfully in a high burden country like Zambia with proper planning, proper buy-in can be achieved.
Hello.
Defining the objective of the campaign is critical. And the need
Somebody mute his microphone
that allows for the widest possible reach. And I think that's my last slide. Yes, so Kumo, thank you. And with U Equal U, we can certainly win. That's all for me.
Thank you so much, Dr. Simon, for this wonderful presentation. And I think this is really, really great for Africa. And I think other African countries will be like this. Without wasting time, I'll hand over the microphone to my colleague, Mandy, she'll be conducting the open discussion. Thank you so much.
Thank you so much, William, and thank you, Simon, for the brilliant presentation. We're really excited to hear that one of the organization in the region is doing that remarkable work. Without wasting any time, we are really behind the schedule. We're now gonna get into different groups. So we're gonna discuss a number of items, and yeah, we're gonna break into 4 groups. And Lamar is gonna, or Cameroon rather, will assist in breaking the groups into 4. Myself, Bruce, William and Kennedy will be split into the different 4 groups, will be facilitating. They'll be recording as well in the private groups. So we'll share the questions that will be discussed in the groups. There are 4 questions that will be discussed. So the same questions will be discussed in each group. And we're gonna take maximum 8 minutes. It will be glad if you can take maybe 6 or 7 because of the time, and then we will revert back to the main group automatically so that you can give feedback. So during the groups, please nominate a speaker or someone who is going to facilitate the discussions or give feedback to the larger group. Over to you, Khan. So the facilitators will actually give you the topics for discussion in the group. We'll put them in the chat in the group. Thank you.
Hello, everyone.
Thank you so much. Thank you so much, everyone. I think everyone is back. So 3 minutes, unfortunately, and unfortunately in our group, we couldn't finish all the questions. 3 minutes maximum, actually, presentation, 3 minutes. Can you have group one? Oh, okay, let me rather call. Kennedy group, can you present, please? 3 minutes max.
Hi, this is the group from Kennedy. I think we're at group 4. So we were able to cover question 1, and we're starting to cover the second question. So for question 1, in terms of what has been effective or been a success, most of the speakers alluded to the Zambia experience, and they included issues of, the engagement of all stakeholders, from government to other leaders and other institutions. So most of us felt that is great, and also, an involvement of peers, and also the lived experiences, and also highlighted that the involvement of healthcare workers was also a success, especially to make them to understand the U equals to U and to own it, because they are most believed or trusted by clients, and it's then easier for them to translate it to clients. So we're also looking at, we started looking at the determination of success, and for this one, we talked about social media, that social media has worked. Thanks.
Thank you so much, Becky. That was powerful and summarized very well. Can I give it to Bruce, your group, please?
Yeah, sure. I'll report back just real quickly. We talked about how how important it was to base messages on messages learned from formative work, extensive, and then looking at the how impressive the extensive stakeholder community engagement was with Zambia, and just how all of the campaigns that we looked at were so vibrant and alive, and I think also that the messages need to be tailored to different audience, and that everyone has a stake, but the way that the messages are presented may be different. And I'll talk a little bit about that later in my presentation, and that the message from Kennedy was really important, that sex matters and sex needs to be affirmed, as John is saying in the comments, and that condoms, talking about condoms, can corrupt the message of U equals U, and I'll also talk about that later when I present. So thank you so much.
Thank you so much, Bruce. And Williams Group, please come forth. Williams Group.
We do not have any kind of
Oh no, I think we are. Oh, it's my connection.
Network problem. I could not network problem in reaching to them.
Okay, I'm not sure if I can hear him clearly, but it seems as if they didn't manage to put things together. But as soon as it gets back to network, maybe you can come in. Oswald, can you present my group, please? 3 minutes max. Oswald?
Yes. Okay. So from the group, we've identified that it's really great that artists are able to represent people like me who are living with HIV. But we feel honored, and it would be great that somebody who's able to relate, somebody living with HIV would feel much better if somebody relating to them is able to tell their stories, and they can believe in that person. People are able to relate well with images and people that they look up to. Then the comment from Michael from Nigeria, government does not buy in artists. They know that somebody is just being paid to talk about certain issues, but if they're able to relate, then it's good. Advocacy requires resources, so that's what we don't have. Yeah, those are the points that were raised.
Thank you so much. Also, just to add on the issue of the experiencing challenges, I think just to add on what you're saying, the issue in Africa is the government buy-in. Unfortunately, you cannot reach a national campaign without a government buy-in. That's what came out from the group. I think big up to Zambia. And measuring success is mainly how people get in the information, how the actual impact of in program. That's how we measure the success in different groups that represented in the group. Thank you so much. We're gonna go back to our program. William, I don't know if you still wanted to present, but you okay? Your group did not want to present, right? Okay, cool. Okay, so I will be introducing William. Sorry. Okay, I will be introducing William. Is one of the founding members of Love to Life in Uganda, and he was born with HIV and openly living with it. He's also working with the Joint Incline Research Center as a peer worker and also a client representative at Kawempe Home Care. William is one of the earliest supporters of the U = U message, and he joined the movement in 2017. As a non-stop social media activist, he has used every opportunity to spread the message globally. Besides social media activism, he has made several U = U presentations in different conferences. That is to say, the U = U pre-conference that took place in Amsterdam 2018, the Africa U = U conference organized by Love Life organization in 2019, and the Adherence 2020 conference. Over to you, William.
Thank you so much. Thank you so much, Mandy, for introducing me. And I'm very, very happy to do this presentation. Like I've been introduced like that. And I work with Love organization, a charity organization that was initiated to uplift HIV prevention measures and awareness, and even supporting children and youth born and living with HIV and those affected by the disease. Next slide. With this slide, these are some of the visuals stroke language that we use as Love organization. But in the first photo, extremely left up, which is showing me with the child, that is the first photo that I posted in 2017 on 12 April 2017. This brought a lot of questions around in Uganda and outside Uganda, because many people didn't know about U = U. But me, when I read about this life-changing message, I began championing this U = U message. So these are other photos. I and my team, we translated the U = U message in our local language, that is Uganda, but Uganda has over 50 languages. And this has hindered us from communicating the message to a broader picture of Uganda. So our message is O = O, and that is obutalabika bwakawuka musaayi kyenkanankana obutakasiiga. I've been doing a lot of campaigns, online campaigns, like I'm still standing to promote the U = U message. And even we have done, these have been done in COVID-19. An HIV colonialism fighter. And we had a march and a conference in 2019 organized by Love organization. We had all over like 100 participants from different parts of the country. Next slide. Intended audience and the reason why we chose this kind of audience. As Love organization, our audience is the general population, that is the general public. We normally go out in schools and we do sensitization on U equals U. We also have gone to different clinics spreading the U equals U message, different local communities, deep in the villages and in urban centers of Uganda. And even we had an engagement with the police officers at one of the police stations in Uganda. Next slide. The reason why we chose this kind of audience, because we know U equals U is for all of us. We should not discriminate this message to only a specific group of people. So the effectiveness of the campaign while engaging our audience, community engagements were so effective, and up to now we're still doing those community engagements. One-on-one talks in our communities that we live in. Social media has also been an effective way of spreading the U equals U message in Uganda. Next slide. What wasn't effective of the campaign while engaging the audience and the challenges encountered? These are some of the challenges that we've been facing as Love organization in spreading the equals U message in Uganda. First and foremost, HIV colonialism. This means withholding or gatekeeping the vital information about HIV and sexual reproductive health. And this has, I remember when I began doing this activism of U equals U, there is a lady in the US who withdrew funding from Love organization because she didn't want us to spread the U equals U message in Africa, because they think Africans, we are reckless about our lives. So I stand against that. Dogma also is another challenge. People's mindsets are still locked up with the old information about HIV. So this is also a big challenge in spreading the U equals U message. Even financial challenges, we would have reached so far in Africa, but we're always limited by finances. And another thing that I always hear and I experience, it is the U equals U is an LGBTQ message. This is very, very wrong. The U equals U message should not be categorized as a gay or lesbian message, because reason being HIV affects all of us, because it does not affect only a specific group of people, but we all of us, we are affected, all infected with HIV. Next slide. Overcoming the challenges. For the case of dogma and HIV colonialism, we believe at Love organization in continuous sensitization, that is to say, educating the general public about the recent and actual meaningful information about HIV and sexual reproductive health. The problem of U being an LGBTQ message, we normally, this message is for all of us, regardless of our sexual orientation. And we should always remember that HIV does not discriminate, but it is we people that do discriminate. As you can see in the photo, I've been championing to stop HIV colonialism in Africa. So I stand that people living with HIV have a right to know accurate and meaningful information about HIV and sexual reproductive health. Next slide. Our success. As Love organization, since 2017 up to date, we have managed to engage with different communities. This includes churches, schools, police, and plus other social media engagements. So as you can see on the left, you are seeing a photo of, this was the conference that we did in 2019 in Uganda. And it like I told you when I was beginning, over 100 people from different organizations engaged in this conference. And this other photo, you're seeing children in, students in schools holding a banner of U equals U. Next slide. For those who are on this forum at the moment, these are the takeaway messages I want you to take. For us, we believe at Love to Love that we can end HIV without a cure at the moment if we continue educating people the lighting message of U equals U, because when somebody who is effectively taking those medication is given medication, that means the HIV will end at that person. You will not be able to transmit or to reinfect somebody who is positive to acquire HIV. So that's why I am saying we can end HIV without a cure if we continue educating people the life-saving and changing message of U equals U. Another point is, nothing can beat down stigma, discrimination, and criminalization than the U equals U message. I've seen this some within our community. When we educate people about the U equals U message, this suppresses stigma, discrimination, and criminalization within our communities. And the last one, U equals U is very vital for treatment adherence and advocating for treatment access for all. So thank you so much for listening and viewing my slides. Thank you so much.
Good afternoon.
Good afternoon.
My name is Joshua Tsenga. I'm told to be very fast because we are behind time. So I will be as fast as I can be, but I'll make sure that we are on point. My name is Joshua Tsenga. I'm the co-founder and director of Phenomenal Youth Association. Next slide, please. Phenomenal Youth Association is a youth-led organization which is consisting of both HIV positive and negative youth, fully engaged in eradication of HIV/AIDS and reduction of HIV new infections by 2030. And in 2016, with the Prevention Access Campaign, a health equity initiative, which was having the goal of ending HIV/AIDS pandemic, as well as HIV-related stigma, launched Undetectable Equals to Untransmittable initiative, where the association, the youth-led organization, PYM, made its first impact as a youth-led organization, which was implementing this initiative, the UU initiative, in our communities, in our country, Zambia, and countrywide, because I've seen a lot of people that have just stepped up. PYA is being found by adolescents and youth who have grown in, even today, living with HIV. But we realize if we only focused on us living with HIV, then it's us doing exactly what we are fighting against, which is the stigma, discrimination, isolation, finger pointing, and a lot that that we are fighting. Next slide, please. Intended target or audience. Our target or audience are people that are living with HIV. Our goal is to ensure that none of them get to go through challenges that many of us who are living with HIV went through. We've had people that have defaulted, like myself, a few members of the organization itself who have gone public, like me. They've had challenges of accepting their HIV statuses. And we've gotten those weak moments in our whole lives, and we've put them together, and they've come so much strength. And we are just trying to give back to our communities and ensuring that none of them get to have these challenges that people that are living with HIV go through. Language and visuals. Next slide, please. On language and visuals, we are using as much language as we are having. We're having over 72 languages in our country as it is. And we are trying to have it translated and understood as much as it can be, so that even somebody who's not having access to internet is able to know what being undetectable is, and how much surety it is for them not to transmit the HIV to their unborn baby, if that is a lady, to their unborn baby, which is a plus. Opportunities and challenges. We have activities which are focusing on that, which is UU education and training, where we usually meet from time to time. Despite the HIV COVID, we try to stick to the number that the Ministry of Health has told us, told the public to be meeting, that is less than 50 people. We try to find places where we can just meet and discuss our challenges with the adolescents and the youth everywhere we are. As it stands, we are intending to be in all the 10 provinces of the country, because this challenge is not only here in Lusaka, Zambia, but also outside. Hence the need to grow and expand in our works. UU support advocacy. We are using that with the face that we are having. People like me and the other team who are representing fellow people that are HIV positive and trying to do their best in the community. Being the picture that, look, I'm HIV positive, I've been adherent to treatment, and I'm undetectable now. I'm living my life to the fullest. I've gone to school, I've done this. We have the no shame about being HIV, which is has been bringing out a lot based out of people, because now there comes in acceptance. If somebody is able to accept their HIV status, then they are able to have the flow with treatment. They have adherence completely. Self-love kicks in. The UU campaign and events, we try to ensure that wherever we are meeting, as little as we are, because we are so many, it's why we're having the S in phenomenal youth, because S is indicating that we are so many. So we're having, wherever we have a chance, we meet and we talk about UU. We use radio and TV, online programs, campaigns to talk about UU. We have many programs like Treatment Journey. Anybody can visit our Facebook page, Phenomenal Positive Youth, where we just talk about somebody who's living with HIV, and I get to be asked questions by the public online. Maybe it's just a 1 hour program, but it depends. Then we have the treatment. We have hot seat where somebody gets to be asked questions, and other online programs. Among them, we have the UU adolescents and youth that are living with HIV. We try to ensure that they get to understand the transitioning that they're having, where we get to make wrong and bad decisions, good and better decisions for ourselves. If we're able to preach and say, look, you're going to change, this is what's going to happen if you are not adhering to treatment, we're trying to make the way smoother for them. Opportunities and challenges. More young people are disclosing their HIV statuses, which has seen a lot of people come out, express themselves about their HIV status, and it's a network that has kept on growing. We started from the base. I was so much honored when I was looking at Dr. Simon. He was presenting the posts, and we could see ourselves, the team, the Phenomenal Youth in the photos in there, and the screenshot. It's just amazing. The health, HIV, the HIV needs to have a face. Way back when HIV came on the scene, somebody was lying on bed, a skeleton and all. It needs a face. It's now healthy. It's having undetectable viral load. It's having a six-pack. It's having a muscle, and it does not look sick. It needs a human face that people are able to relate to and see that there is life after HIV diagnosis. More use on TOD for quick suppression. I think also the good part on medication, if we are able to talk about the relevancy of the good part of TOD, the importance of it bringing undetectable in a very short time, it will help a lot of people to stay in line and on treatment. Those are tools that we are using. Then we're also trying to fight myths around the UU message, because many people still believe if I'm undetectable, then I have to stop treatment. If I'm undetectable, then it means that I'm healed. So this is the information that needs to go on and on. Knowledge and proper practices. We feel like if we're able to have accurate information, right information, we can do better in understanding and disseminating the information that we are sharing. Next slide, please. In this COVID period, it has differently, and whether the way we used to gather as a team, this photo where we are many, it's the launch of the UU in Zambia. Me and the team, we are honored to be invited by Biflo, an artist, because he knows our works. We've been doing some of the promotion of UU since way back, and we were just honored to be part of the journey of the video that was that gave out so much message on UU. Next slide, please. So we use these photos, our images of ourselves. This is me. This is how I was looking. This is me. I take drugs. I take ARVs, and I'm looking this healthy. I'm doing the best. In this COVID period, I'm putting on my mask, meaning the person needs to understand that despite the COVID period, the HIV is still there, and one to be as in perfect health, they need to adhere to treatment, and having a lot of programs that are able to push them to maintain adherence. Next slide, please. The UU campaign has been accompanied by the No Shame campaign, because we feel like for somebody to be able to stay adherent to treatment, then they have to accept themselves. If they're not ashamed about their HIV status, then adherence will be clean, diet will be clean, they'll have a free mind, and they'll attain undetectable viral load in a short time and maintain it. We feel like using real people and real emotions, real life is the best way that can help people maintain their adherence, help people to understand that HIV is with people, and if we can have, next slide, please. If we can have people that are able to express themselves, put on the UU message without shame, and a lot more, I think will be better and encouraged. These are some of the testimonies of people that have gone that have just been transformed by the news. They could share in the group, they could WhatsApp you, they would just be glad because they feel like it's the best thing that can happen. Which is the best thing that can happen to somebody living with HIV? Understanding that you're undetectable and you cannot transmit HIV, because ever since you were young, you felt like you're going to infect somebody, maybe your child, and you don't want your child to go through the steps that you went through. And that has been just the dilemma of a lot of us. And with the movement of the UU, it's just a plus. And it's why it's important for us to ensure that the UU message is shared. Next slide. Effective. With the launch of the UU message in Zambia in 2019, many people are understanding it, especially those who would follow us back, and the launch of UU, it gave a lot of people relief because it was now said by the Ministry of Health and partners, and it was a delight. More young people are actively talking about it, positive and negative. When you see young people talking about something positive, then it means you know that the adult phase is way better, because people understanding good stuff, good information at a very good age. Sharing stories of defaulters now adhering to treatment, it is a plus. Somebody who defaulted, they defaulted in 2017, and now they've picked up the drugs. they know about UU, the good news that it's bringing. It's also reduced stigma and discrimination at a very good gap. And it's why I feel if we are to change or defeat HIV, because this is war, if we have to defeat HIV completely, then the UU will be very much effective. It will help us do wonders in our communities that we are in and at a very global level. And a lot of happy families will grow and loving will grow. Next slide, please. Lessons learned, young people, if young people are in front of this movement, I say again, the next generation will be very much safe from HIV, and people who have accurate information, vital information on UU, the effectiveness, understanding that they cannot stop drugs, they cannot throw away their treatment just because they have attained UU. The importance of adherence will be understood, and it will do wonders. The power of social media, I think we need to utilize it, especially with platforms that are very much followed and it talks a lot more about HIV and related illnesses. So as it stands, social media is a very powerful tool. It's able to build somebody and break them according with the content that somebody is able to share. So I feel if we're able to use social media as a tool, many lives, many people will get to understand the importance of UU. Then we also have the community-led works, which are able to help and build communities to understand better on UU. Helping people understand UU will also change the concept of somebody understanding that since I'm UU, then I'm not supposed to continue drugs. Or those people that test negative, which is false negative after starting treatment, they'll know that it's not negative. If it's not negative, then they understand that it's false negative and they are not supposed to default treatment. Then this will bring out the protection of the discordant couple, a couple that is dating or married, one is positive and one is negative. It will give peace to the other partner, understanding that they cannot transmit, and a lot of prep and more in practice, which is a lot better.
Beth, please.
Beth of negative.
For the interest of time, we are going to proceed
Next
to another
slide.
speaker.
It's done. Thank you very much.
You're welcome. Thank you for that presentation. As per now, let me introduce Bruce Whitman is our next presenter, and he's going to discuss more of the global lessons of U equals U. This is the mind behind all our efforts. So Bruce Whitman is the founding executive director of Prevention Access Campaign, which launched the U equals U advocacy and communications campaign in 2016. Now a global movement. We collaborate with people. We collaborate with people living with HIV, advocates, public health officials, researchers, and allies on every continent to ensure that U equals U message reaches the people it was intended to benefit. It envisions a world where people living with HIV are empowered to love and live finally without any fear of passing on HIV. So Bruce Whitman, the floor is yours.
Thanks, William. Can you hear me okay?
Yes, we can hear you.
And William, can you just see the one slide, U equals U communications?
Yes, I can see on one slide.
Just one slide.
Yes,
okay.
yes.
Okay, great. Thank you. So in the interest of time, I would actually reflect on a lot of the presentations previously that were so impressive and inspiring. And William, talking about me being the mind behind this, I'm not the mind by any means. I am actually just listening to all of you, and for the last 5 years, learning so much from your creativity and innovation and courage. And that's how U equals U has grown to where it is today. And that's what I'm going to share a little bit of now. It's going to be a shorter presentation than I planned for today, and it's much shorter than I usually give. So I wanted folks to know that if you want more of this presentation and go more in depth, I'm happy to do this presentation anytime to anybody who's on the webinar. As also share the slides with you and show you how to present these slides as well. It's important to get the message out and get it out correctly. And we are getting the message out now in 102 countries. These are lessons that we have learned from not all those countries, but a lot of those countries. And one is we communicate about why U equals U is important about the same things, the same reasons that U equals U are important to us, are important to people around the world. Now, it depends on who you're talking to. Some things may be more important than others. For instance, the well-being of people with HIV, our health, our social and sexual reproductive health is very important to us and the people who care about us. And as is stigma. Stigma has effect not only on our own lives, but on the lives of people who are at risk for HIV and the general population. Treatment goals, this is what doctors, healthcare providers often care about the most, is how U equals U can address treatment uptake, adherence, can also improve people's HIV testing rates and viral suppression. And then policymakers care about the public health argument. So how can U equals U be a tool for ending the epidemic? How can U equals U be a policy argument to increase access and remove barriers to treatment and care? So the treatment guidelines are all the same, no matter where you are in the world. Stay on your treatment, adhere to your treatment, get your labs done, and stay connected to care. That's it. The message is not that difficult. It really isn't. And if someone says it's difficult, it's because they're uncomfortable and they're too lazy to explain it to people. It may be difficult to do these things, to get your viral load test, to access medicine, but the information is not difficult. Stay on your medication, get your labs done, stay connected to care. Now, the nuances are also not difficult. It's under 200 copies per milliliter that people talk about. And this is about sex. It's not about breastfeeding or injection drug use. And this is about HIV prevention, not other STIs. So when we communicate, these are the things, the basic nuances that we try to get across. Now, what we communicate is as important as how we communicate it as well. So we need to be clear, we need to be confident, consistent, and we need to be conscious in the way that we talk. And when we talk about clear, we have to say phrases that don't give any room for doubt. Because if we say words like on the right, like virtually impossible or close to zero, that still is a window of risk. And it's not true. And any window of risk puts our lives at risk as people with HIV. So we've got to be clear in our messaging. We've got to be confident. We don't need to say things like, oh, use a condom just in case. But we might want to communicate that, look, condoms aren't necessary and PrEP aren't necessary to prevent HIV, but they will help prevent STDs and pregnancy. This may be important if your partner's struggling with adherence and other issues there. Confident. We get people saying you're only as good as your last viral load test and terrifying people. No, don't say that. Lead with the carrot, not the stick. Look, if you're getting your medication done as prescribed and having your regular viral test, you can feel confident. You don't need to worry about passing HIV on. Don't say the catch-all, you never know. We hear that sometimes. Well, we do know. And consistent. This needs to be heard over and over again because this is radical change and change is uncomfortable. And for people to be able to accept change and really believe this message, it needs to be repeated. It needs to be repeated by the right messengers, whether it's political leaders or peer influence. Usually peer-to-peer is very powerful, but finding the right messengers to communicate it. Make sure it's visible, because if it's not visible and it's hidden on page 5 in the middle of a paragraph, it means it's not important. That's the message that you're sending. It's got to be visible. And promote through multiple sectors. If it's only going through one channel, it's not going to take hold. But the way that this works, the way that this grows is through multiple channels, through community, through the government, through all different media, mainstream media, and conscious. Viral load does not equal value. We need to be really careful in our language and loving, and recognize that many people do not have undetectable viral loads, some by choice and some by circumstances outside of their control. control. So we need to name that, and we need to ensure folks that no one with HIV is a danger, regardless of viral load. There is PrEP in some parts of the world, and there's condoms for hot and safer sex. Also, treatment's a personal decision. It's not our job as people with HIV to get on treatment to prevent spreading to others or to end the epidemic. This is about our health first, and a great, incredible benefit is prevention. And then finally, we really have to make sure that leave no one behind is more than a hashtag. We need to use U equals U as an argument to help ensure that others have access to treatment and care. And when we talk about U equals U, we need to bring that into the conversation so someone in that room or someone you're talking to doesn't feel left out because they don't have access or they're struggling with barriers. We need to make sure, look, we are working on this, and as an organization, that is our high priority. So thank you so much. Sorry, there's a bit of rush. I know we're going to go quickly into Q&As now, so I'm going to pass it on to my colleague, Mandy, for just a few questions.
No, aren't we having Prof. Venter?
No. In the interest of time, he is not speaking. He actually had a call to leave to, so he wasn't able to.
Okay, thank you. Thank you so much, Bruce. And thank you for that presentation. It really gave me goosebumps. Yeah. So yeah, we're gonna go through very few comments and questions, but you can keep others coming. There's a question that says, apart from UKO's message that the group provide any form of support to members with a detectable viral load, other than motivating them to stay on treatment and be virally suppressed, what other support are we giving people with a detectable viral load? So any of the speakers can shoot. Okay, let me just come in. For instance, one of the support that we're giving is more of mental support, psychosocial, psychological, because there are many issues that actually leads, as Bruce was saying, some other people is by choice, some others is because they have not disclosed status to the family members, they can't take treatment in front of their partners and all that. So we motivate them to disclose, and we look at what is the reason behind them not being detectable. And if maybe it's an issue of accessing treatment, there's a stock out in facilities and all that, we engage with local authorities. I'm not sure if there's any other input from my colleagues. Okay, all right. So how to balance messages about condoms in the context of U equals U? Bruce, I think you can shoot into that. We'll add if there's anything to add.
Oh, you want me to answer that? Yeah, I think it can be, condoms are a separate issue. Messaging needs to be clear that condoms are not needed to prevent HIV transmission when someone's undetectable, sexual transmission. That has to be really, really clear. If you have a condom in your messaging, make sure if you have to have condom there, and we make it very clear that condoms may also be considered for other STIs, and underscore that they're not necessary to prevent HIV. An undetectable viral load fully prevents HIV transmission during sex. And then language like that makes it clear. But we're not, you have to also, it depends on your audience. Sometimes in the very beginning of a talk or a meeting, we'll say, this isn't about promoting condomless sex, because we know everyone in that room is scared of condomless sex. And so we try to address it right off, and there's other ways we could do it. I don't want to take more time, but just know your audience. If they're very sex negative, talk about babies. Talk about having babies. Don't talk as much about sex. Know what's going to trigger them emotionally, an emotional response where they won't hear you, but you make it easier for them. So if they're concerned about condoms, bring condoms up, and mention that we're still encouraging to reduce STIs and unintended pregnancy.
Thank you, Bruce. I think that also respond to the question that says, Bruce indicated that condom messages may corrupt U equals U. Someone shares some inside best practices. Probably that's actually, responding to that. So there's a question that says, William, the HIV colonialism message is very compelling, How has it been received? Does it resonate with people in Uganda? I think this one goes to William.
Mandy, I did not hear. I've got a problem with my headsets.
Okay. The HIV colonialism message is very compelling. How has it been? Does it resonate with people in Uganda?
I'm not getting you properly. My headsets are not working properly.
All right, the HIV message, how is it received by people in Uganda?
HIV
Are there
what?
any push, the HIV message, the colonialism message in HIV space, it's normally compelling. Is it received positively by people in Uganda?
Not really. They don't receive it that way. And even Uganda, fellow Ugandans have also are gatekeeping this information because they think that we are getting a lot of money out of U equals U. So they think that we are getting huge sums of money because we are pushing the U equals U message. Our fellow activists, that those who are advocating for other things like PrEP, condoms, and other kind of prevention measures. So most of them, they fight back us online, and when we meet in other conferences, they try to fight us, but we keep our promise of preaching the U equals U message because I'm not saying that other prevention measures are not working, but U equals U, the science has proven that it is 100%. So we should embrace the U equals U message in Africa and globally. Thank you so much.
Thank you so much. I think there's one last question for Bruce. It says you mentioned centering the benefits of U equals U. This makes sense, but I'm also curious whether anyone has had success talking about U equals U as the best secondary prevention strategy or a way to protect your partner in a way that is non-stigmatizing.
Oh, that's a good question. I mean, when I mentioned that, you know, that sort of we're not prevention tools and to focus on personal health versus public health, I don't mean not to focus on public health. I mean, just not to sort of coerce, like everyone with HIV needs to get on treatment so we can end the epidemic, you know, that kind of phrasing. I think there are many ways that say it that are empowering to people with HIV. If you get on, you know, if you're undetectable, you stay healthy and you can't pass it on. If you stay healthy, and it's the most effective way to prevent HIV, and it's 100% effective to prevent HIV. So there are ways that it can absolutely focus on prevention, you know, without being stigmatizing. And there are ways to focus on prevention and to be stigmatizing. Just always think, would a person with HIV feel like they're an HIV prevention tool based on the language that is being said? Will that make them seem that their life is all about preventing others from getting to the disease rather than living their own life and preventing others from getting the disease?
Thank you, Bruce, and thank you, everyone. I think we were 3 minutes behind our schedule, but we're getting into closing. Just holding there. I'll hand to Kennedy just 2 minutes close-up remarks. Thank you so much. Over to you, Kennedy.
Yeah, and I'd just like to jump in and say, if folks want to stay on after as well, I can stay on for another half an hour if needed. Just to, it's great to see so many people too. I just want to catch up as well as talk.
Yes, thank you so much. Thank you so much. I just want to say thank you, everyone. Thank you for having found time to be part of this empowering session. This is part of one of the benefits of treatment that most people are reluctant to talk about. And you have shown that you can actually be able to be part of us. And we really thank you. We are so grateful to you. So we'll stay in touch. This is just the beginning, guys. We'll have other sessions because you know, can be addressed from all angles, different angles. So perhaps in the near future, we'll look at how just to do a communication strategy on U equals U, or to just share your in-depth lessons that you've learned from this session, kind of report back and feedback from this session. So you please also feel free to email us. Feel free also to join our WhatsApp group. It's Africa Forum, U equals U Forum, and we'll be very, very happy to host you, to be part of this group. We thank everyone because of time. We're behind schedule. I don't have much to say, but I just want to say thank you guys for finding time to be part of this session. Thank you so much.
Thank you, everyone. As Bruce was saying, if there's anyone who still wants to remain behind and maybe ask any questions, he's going to be available for the next 30 minutes. I can still stay on as well as a facilitator, yeah, until we have 0 participants. So yeah, thank you so much, everyone. Those who need to jump off can do that. See you next time. We are in this together and we can do this. Thank you.